Hi, this is Dr. Ramin Tayani, ophthalmologist and oculoplastic specialist, board certified ophthalmologist at the Tayani Institute. Thanks for joining me today in our YouTube presentation of how to care for eyelids after eyelid surgery. So I'm going to actually go through the steps before the surgery, on the day of surgery, and then the aftercare. A lot of patients get confused when we do the surgery. We talk about it and multiple times, but then when the surgery comes and happens, and then they're forgetting, what does it have to do? What does it have to do? So hopefully this video would help you at home if you ever forget. So as you know, there are many different eyelid surgeries. If it's a droopy lid or excess skin on the upper lid or a lower lid droop, or you're just doing cosmetic surgery for the eyelids, the care is pretty much the same. Before surgery, there's nothing to do other than just mentally get ready for your day of surgery. And it's either cosmetic and you're getting excited to have younger looking, rejuvenated eyelids and face, or if it's a reconstruction because of cancer or trauma or some kind of a deformity of the eyelids. Let's say it's an ectropion where the lid is drooping outward, or the upper lids are drooping because of age, or anything for that matter. So beforehand, there's really nothing to do, no medications to use, nothing except for the night before surgery. You should be eating or drinking nothing more than, you could do anything you want up until midnight the night before surgery. So if the surgery is on a Thursday, you don't want to have anything to eat or drink after midnight Wednesday nights. On the day of surgery, you come to the surgery facility about an hour before the surgical time. The nurses will get you ready, put an IV in, give you some sedation, some relaxation medicine. In many cases, our eyelid surgeries are done with no general anesthesia. You're sedated, but not asleep. And on the other hand, some patients prefer to be asleep, or we're doing a lot of surgery and we would want to put you to sleep. So either way, it could be under general anesthesia or what we call monitored anesthesia care, MAC, with IV sedation. Regardless, you get local anesthetic placed. The surgeon will be marking you in the pre-op area, so the amount of skin that we need to take out, or marking about what needs to be done. The roadmap of the surgery is done prior to surgery, and then the anesthesiologist, nursing staff see you, get you ready, and we take you to the operating room. Upper lids take about 20 to 30 minutes to do, unless it's more complicated stuff like a muscle surgery, then it could take up to an hour for both sides. And depending on what we're doing with the lower lids, it could be anywhere from 30 to 90 minutes for that, and we do the surgery. Once the surgery is done, sutures are placed, ointment is placed, and you will expect to have blurring vision post-operatively. But it's not like your eyes are covered. You will be able to see through the surgery, after the surgery. So here's the key things that you need to know. Ointment is to be used. We give you a small tube of ointment. Typically it's an antibiotic steroid combination. You put that onto the incision. If it's the upper lid, you put it on the incision there. If it's a lower lid, you brush it onto the lower lid like this. And for sure, you want to put some ointment on the eyeball. Best way to do that is just pull the lower lid down, squirt the ointment right onto the eyeball, and close the upper lid. Gently do this to massage it, and you're done. So again, repeat, ointment goes on the wound, up the upper lid, lower lid is brushed on, and on the eyeball, you put it at bedtime. This will help in the event that the eye doesn't close fully, that the eye is still lubricated and protected from the air. Throughout the day, you will use artificial tears 4 times a day minimum, but you can use it as much as you want, 10, 20 times a day. If it feels better, you can use it. Artificial tears are over-the-counter lubricating eye drops. I do not want you to use anything that says gets the red out, so Visine type products I don't want you to use, but anything else, any other lubricating drop, I don't care the brand name, you can use it, and you can use it as much as you want. If we give you an antibiotic drop, then you would use that as well 4 times a day. So in summary, 4 times a day artificial tears minimum or more, and 4 times a day of the antibiotic or antibiotic steroid combination drop, and then the ointment goes in at bedtime in the eye and on the wounds. Some patients after surgery will have some swelling. Everyone has a little bit of swelling, but some patients have excessive. If you have a lot of swelling or oozing, one thing to remember, and I'm going to show you this in video form, is to put some tissue or gauze in the palm of your hand, close both eyes, and apply firm pressure like this on both eyes and hold it for about 1 minute. This will help. You're almost like squeezing the swelling out, or you're stopping the bleeding. So that is something to do several times a day, 3, 4, 5 times a day. But when you do it, you hold your hand firmly on the eye for a period of 1 minute. So count to 50. Again, put some tissue or gauze in the palm of your hand, close both eyes and apply firm pressure, hold it for about a minute, and do that 3, 4 times a day after surgery. That'll help minimize the swelling and bruising and oozing of any blood from the incision lines. It's always helpful to have the head elevated with 2 or 3 pillows for the first 5 nights. We also recommend using ice or a cold pack, 20 minutes on, 20 minutes off for the first 48 hours while you're awake. You don't have to wake up in the middle of the night to do this, but do it for the first 48 hours while you're awake, 20 minutes on, 20 minutes off. The first 48 hours also we want to keep the wounds dry, so avoid getting the incision line wet only for the first 48 hours. After 48 hours, you can shower normally, and again, showering normally means just let the water hit the scalp and run down. You just don't want to sit there with the water hitting the incision line, but if it runs over the incision line, that's fine. As far as activities, again, minimal activities for the first few days. You could drive the next day. You can do most of your normal daily chores, but exertional stuff, even golf, I would hold off for about 10 to 14 days. That's pretty much the care after eyelid surgery. And remember, we are always available to our patients 24/7. If you need us, call the office 949-489-2218 and hit the buttons for the doctor on call. And remember, I always give my cell phone to all my patients that I operate on, and you're welcome to call at any time, and I will call you back. Again, thank you for joining me in this YouTube presentation. This is Dr. Tayani, ophthalmologist at the Tayani Institute. Till next time, have a good one.